All right, you guys, welcome back to our healthcare series. This is episode number 2. Today we are going to be talking about when your hands don't work the way they used to. All right, so I'm here to help. We need to talk about this, you guys, because this does happen. We all get old. That's what I was saying in the first episode. And if you're new to the channel, like and subscribe. And you guys, listen. We have to talk about it because I want to know, have any of you guys ever awakened to numb hands and had your fingers lock while just doing anything? Like maybe you're doing a crossword puzzle and your hand is in pain or there's stiffness. Has that happened to any of you guys? No matter what your age, this can obviously happen. Okay, so you don't have to accept this discomfort or disability, but this is the consequences, obviously, of aging. Okay, so there can be a host of different treatments that you can do to alleviate the pain and to improve the function and your recovery time. So look, you guys, many conditions can be treated, okay? And when surgery is necessary, you can often use your hands immediately after you get these procedures. So this doctor is trying to say that, I guess he's talking about some guy whose hand was injured in the Boston Marathon bombing. So this doctor specializes in helping people get relief and to regain function after, they've lost, I guess, had some issues with their hands or some type of wrist or hand disorders. Okay, so carpal tunnel syndrome. It says that basically a channel formed by bones and cartilage that runs from your forearm to your arm. Okay, so I guess they're trying to say carpal tunnel syndrome occurs when the transverse carpal ligament, which forms from the roof of the tunnel, thickens, narrowing the space and compressing the median nerve. This causes numbness and often pain in your fingers, especially at night. Okay, so that one's a little weird, but I think Kim Kardashian says she has that issue. At least I think I heard her say something about that. Okay, so you guys, in mild cases, carpal tunnel syndrome can be treated with a nighttime brace or cortisol injection. Has anybody had that? When the numbness and pain are intermittent, surgery is typically very effective in relieving symptoms and preventing progression. If you have these symptoms, you should get an evaluation sooner rather than later. Okay, that's what the doctor is advising. Okay, and also I will have a link below of different stuff that you can do at home self-care treatment for if you have, like some type of issues with your hand or, your wrist. And other little things like medicine that you can purchase. All of these will be available at Amazon, of course. So look, surgery to release the tunnel can be performed through small incisions that allow the surgeon to see the nerve directly. And I guess they're using some type of tiny camera, I guess, to look to see an image of the nerve that's damaged. The surgery is done under a local anesthetic with sedation and takes approximately 15 minutes to complete it. If you get to the point to where your hands are constantly numb or weak, it's probably too late to try to reverse it. The nerve damage associated with carpal tunnel syndrome. Oh, this is so sad. However, surgery can still prevent the condition from getting worse. It just hurts just hearing about it. Although the improvement may not be as great as you'd like, they're just making me so sad with hearing about this. Trigger finger. The muscle that operates your fingers are located in the lower arm and are connected to your finger bones by long tendons that glide through the finger joints like a clothesline running through a pulley. When a tendon or sheath surrounding is inflamed and thickened, the tendon can't move through the joint smoothly and it can become stuck as finger flexes. Okay, so Your finger may lock in or either straight or flex position, and you may have to use your other hand to bend it or pry it open. You may hear a popping sound as your finger unlocks. If your finger locks only occasionally, they said that there's some non-steroid anti-inflammatory drugs that may alleviate the inflammation. Trigger fingers can also be treated with cortisol injections, okay? Although the injections may need to be repeated 2 or 3 times, the treatment is successful about 60% of the time. If cortisol treatments doesn't help, minor surgery in which a needle or thin scalpel is used to open the sheath can help the tendon go through the joint more easily. Okay, so arthritis. 2 of the most common problems with arthritis occurs at the joints nearest the fingertips and those at the base of the thumb. Treatment for arthritis of either joint usually begin with an NSAID to reduce pain and inflammation and splints to immobilize the joint. So although there isn't a cure for arthritis, there is a lot we can do to relieve pain and improve function. Okay, so you guys, this is all scary. I'm scared hearing about it. Arthritis in the joint closest to the fingertips may be limited to painless, bony overgrowths called Herberdin nodes. We usually don't treat these because they are largely cosmetic. This doctor says, but when the joint is so painful and deformed that the fingers become difficult to use, surgery to fuse it can alleviate pain and strengthen the fingers. I recommend that, you guys. Although you won't be able to curl the tip of your finger like a joint fusion, the pain relief may be worth it, okay? Arthritis at the base of the thumb can be even more disabling, making it hard to open jars, turn keys, and do finer work like stretching and knitting. Occupational therapy, in which you are taught techniques that put less pressure on the joints and are introduced to assertive devices like pens with rubber grips and kitchen implements with thick handles, can be helpful. When more conservative treatments are inadequate, cortisol shots may relieve pain and inflammation, okay, in short term. Corrective surgery to remove this arthritic bone can keep bones from rubbing against each other and provide significant pain relief. Your surgeon may also use a tendon from your wrist to stabilize the joint. Recovery takes weeks, but the improvement can be subtle. Most people are very happy with the results. That's what this doctor said. Okay, so next on the list is fractures. All right. This can occur when you fall, okay, and increasingly common as women age because wrist fractures are often the earliest of fragility fractures. They can be useful indicators of bone loss after a wrist fracture, and is often helpful to get bone density tests. I would also recommend taking some vitamins to help, like vitamin D. And I guess at that age, getting back to drinking more milk just like babies. And also, if you guys are liking this content that is for an older crowd, like the videos, subscribe, was talked about in the comments. And don't be afraid to support me and buy me a drink or whatever through Cashapp. Okay, so look, you guys, if you aren't taking a bone building medication and your history or scan shows you need one, you should start a bisphosphonates 2 weeks after a fracture. That's what this doctor is saying. That's a really large word. If you are already taking this, they're trying to say there's no evidence that it's necessary to discontinue the drug while the bones heal. Recent studies have shown that fractures in women using this were once thought to inhibit bone repair heal just as quickly as those women who aren't taking them. But okay, so to make a long story short, they're saying surgery allows you to use your wrist and hand during healing, which can be really important, especially if you live alone. And I guess they're saying it takes several weeks for the bone to heal during, I guess, surgery. During that time, the wrist can be immobilized in a cast, and it can be treated with surgery which screws, pins, or more commonly a thin metal plate with screws can be inserted to hold the bone together until the fracture heals. Okay, so they said this is Raynaud's phenomenon. The body normally reacts to extreme cold by constricting blood vessels in the hands and feet to divert blood flow to the internal organs to keep them functioning. If you have Raynaud's phenomenon, it doesn't take sub-freezing temperature to provoke a reaction. Sitting in an air-conditioned room or even a stressful event can render your fingers cold and numb. Oh no. I had a situation where I was on vacation in Germany and my hands were so numb from being outside. I had to live outside for the night. Like, it was a campsite and you had to pay about like $65 to stay at this camp, and you sleep outside in a sleeping bag with everybody. And my hands, it was so cold, they were getting numb. And I was like in my 20s having these. So what's going to happen when I get to be really old? Oh no. Okay, so living well with arthritis, a guide to relieving your joints and pain. Okay, so I guess they've created a guide to help people. I definitely say, you guys, we have to work on taking care of our health early because we will all get old eventually. Okay, so during Raynaud's episode, your fingers may turn white then blue as spasms in small vessels restrict blood flow to them. Your sense of touch may be blunted, making it hard to grasp objects. When the spasm ends and the vessels open up, blood will rush in and your fingers may flush bright red. They are likely to throb and tingle as feeling is restored. Okay, so how does Raynaud's phenomenon progress? I never heard of this until today. So they're trying to say that your fingers, this just sounds crazy, turn white as small arteries in the fingers tighten, restricting the flow of blood to the skin. As oxygen in the blood is depleted, the fingers turn blue and become painful. Eventually, I guess they're trying to say blood once again enters the fingers, warming the skin, turning it red. Raynaud's can be aggravating and painful, but you can often abort an episode by running your hands under warm water or waving your arms in circles to get the blood flowing. I'm guessing that doing this, it makes your hand feel better. Like, to shake it out. Okay, so has anybody else heard of this disease that we're talking about? Some people have success using biofeedback techniques to dilate blood vessels. Okay, you may also want to keep reusable gel warming packs in your bag or pocket to use when you feel an attack coming on. You may also minimize attacks by avoiding common triggers like caffeine, beta blockers, and cold medications containing pseudoephedrine. More severe cases, which often occur in people with scleroderma, lupus, or rheumatoid arthritis, may require medical treatments. Drugs to dilate blood vessels such as calcium channel blockers or other blood pressure medications are often effective. Botox injections may also reduce the number of Raynaud episodes. Okay, that was scary, right, you guys? That was a lot to just take in, you know. And also, if you guys are new to the channel, like and subscribe. Don't forget, I have a prison series that I would really love for you guys to check out. And don't forget, you can check out my death series and check out me talking about Diddy to you guys. Okay, so look, the causes of hand weakness. Okay, so hand weakness or heaviness could be caused by a number of conditions, such as carpal tunnel syndrome, arthritis, a herniated disc are some of the reasons. So Sudden hand weakness is concerning as it may be a sign of a stroke. Oh no. A serious medical emergency. However, if you have had a nagging hand weakness, it's usually not related to a serious medical problem and is rarely life-threatening, okay? Hand weakness lasting for weeks or months is typically caused by a treatable medical condition. If left untreated, the weakness can worsen along with the underlying cause, okay? This article that I'm looking at, they're trying to say that there's 12 possible causes of sudden and persistent hand weakness, including accompanying symptoms and how each is diagnosed and treated. Okay, so let's get back into talking about the carpal tunnel syndrome. This is one of the most common causes of hand weakness and pain. Carpal tunnel syndrome is caused by overuse of the arm, wrist, hand, often due to repetitive movements such as operating machinery or typing. Carpal tunnel syndrome is caused by swelling on the inside of the wrist. The swelling compresses a nerve called the median nerve that travels through a tunnel of bones and ligaments inside the wrist. Symptoms of carpal tunnel syndrome include pain, tingling, numbness, weakness, loss of coordination of the hand. I don't like that, right? It sounds terrible. The pain and weakness can travel up the arm if the pressure of the nerves persists. It sounds terrible. Diagnosis and treatment. A healthcare provider or physical therapist can usually diagnose carpal tunnel syndrome by reviewing your symptoms and examining your hand and your arm. Sometimes a nerve conduction study, which tracks electrical activity through nerves, may be needed to confirm the diagnosis. Okay? So carpal tunnel syndrome is a treatable problem. Rest, ice, and over-the-counter anti-inflammatory medications usually help. A wrist brace and adjustment of the wrist motion during work can prevent carpal tunnel syndrome from getting worse. For most severe cases, a simple surgical procedure called carpal tunnel release severs a ligament in the wrist to relieve pressure. Okay, so they're saying, no, that severs a ligament in the wrist to relieve pressure. Interesting, right? So, they said diabetics is a chronic medical condition in which the body is unable to properly regulate blood pressure. One of the complications of diabetes is nerve damage, referred to as diabetic neuropathy. Diabetic neuropathy most often affects the hands and the feet, okay? So, when it affects the hands, diabetic neuropathy can cause pain, weakness, tingling, and trouble coordinating hand movements. Diagnosis and treatment. Most people with diabetic neuropathy are aware they have diabetes, but in some instances, diabetic neuropathy may be the first sign of diabetes. It sounds terrible. So again, those symptoms would cause weakness, pain, tingling, trouble coordinating with your hand movements. Okay, so your healthcare provider can often diagnose diabetic neuropathy based on your symptoms, medical history, and a physical exam. Blood tests can identify whether you have diabetes. The next step involves diabetes management, which can help improve symptoms, okay? Especially if they have not been occurring for too long, all right? So, peripheral neuropathy. While diabetes is the most common cause of neuropathy, there are a number of causes that can also cause hand weakness, okay? Neuropathy that occurs in nerves outside the brain and spinal cord is referred to as peripheral neuropathy. The hand and feet are most commonly affected. So peripheral, this one's tough. Okay, so different diseases. Okay, so that can be caused by alcoholism, chemotherapy, HIV, chronic liver disease, chronic kidney disease, hypothyroidism, lupus, lead poisoning. Wow, it's too much. Other arthritis, traumatic nerve injury, vitamin B12 deficiency. It sounds crazy. Symptoms. Irrespective of the cause. Okay, so they're saying that pain, numbness, tingling, burning, and weakness are the symptoms. The treatment and diagnostics. Your healthcare provider may need to take blood tests to determine the cause of neuropathy is related to an infection, autoimmune disease. Okay, so it could be some metabolic disorder or nutritional deficiency too. Okay, so let's see what else they have to say. What vitamin deficiency causes hand weakness? Vitamin B12 deficiency can cause hand weakness. So it looks like we need to take vitamin B12, you guys, to keep our hands functioning the best we can. Okay, so a reduction in hand grip strength has also been associated with other nutritional deficiencies, including vitamin D deficiency. Arthritis, also referred to as wear and tear, is a condition that causes progressive deterioration of joints. Stiffness, weakness, pain, difficulty gripping, deformity of the finger joints. So that's what's affected. It sounds terrible. If you have arthritis, you may be able to ignore the milder or early symptoms, but over time, as the breakdown of joint cartilage continues, the pain and the weakness can worsen and become debilitating. It sounds terrible. I feel scared just hearing about this. Diagnosis and treatment. Your healthcare provider can diagnose arthritis based on your symptoms, a physical exam, x-ray, and possibly blood test. Arthritis is a painful condition that is treatable with anti-inflammatory drugs, ice/cold application, and physical therapy. It can be debilitating and is rarely life-threatening. And also remember, below in the description and the comment section, I will show you items on Amazon that you can get that will help you try to do the best you can with doing your at-home treatments. And also, you guys, don't forget to like and subscribe. And again, support the channel and get me a drink. That would be nice. Okay, so look. Sir, all right, so this next one, why are all these diseases very difficult? Radiculopathy. Okay, so many people experience radiculopathy, the pinch of a spinal nerve root at some point in their life. This can occur when spinal bones degenerate and collapse, and when there is a traumatic spinal injury, or when there's a displacement of tissues between the spinal bones. So maybe that happens in a car accident. I've been in a car accident. So symptoms: a pinched nerve in the cervical spine of the neck. Oh no. Can cause hand weakness because this is the part of the spinal cord that controls hand movements. Sometimes a pinched nerve in the neck can cause pins and needle sensations, back or shoulder pain, shooting pains in distant parts of the body such as the leg. Diagnosis and treatment. Your healthcare provider can often tell if you have pinched nerve based on your symptoms in a physical exam. A nerve conduction study and imaging tests like computed CT scans may be needed to confirm the diagnosis. Okay, so the treatment varies by the cause but may include anti-inflammatory drugs, steroid injections, or different types of surgery. Physical therapy can also help. Some people with a pinched nerve improve without any treatment. Okay, so they're trying to say something like a pinched nerve can develop for women who get pregnant too. Okay, so the next one is a herniated disc. This is a displacement of the cartilage that supports and anchors the spine. The herniated disc can press on the spinal nerves and affect how they work. Because the spinal nerve roots control many different sensations and movements of the body, the building of a disc can trigger different symptoms based on where it occurs. So symptoms of a herniated disc in the cervic spine can cause nagging pain in the hand or the arm, weakness in the hand or the arm. Okay, so diagnosis and treatment. Your healthcare provider can diagnose a herniated disc based on your symptoms. A physical exam and an imaging test such as spinal x-ray and spinal CT scan or spinal magnetic resonance imaging MRI scan. Okay, cool. A herniated disc can be treated with physical therapy, anti-inflammatory drugs, or opioid medications. Surgery may be used in certain situations. Even so, the pain and weakness may not always be resolved with surgery, okay? So be careful, and consideration is needed to weigh the possible benefits and the risk. If you have a herniated disc, it's usually recommended to take extra care when doing physical activities, especially when lifting heavy objects. They're scaring me. Are they scaring you? This all sounds scary. Saturday night palsy. Oh no. Known as compressive neuropathy, is a specific kind of nerve damage that occurs when the radial nerve of the upper arm is compressed for a long time. This is often caused by sleeping in a position that presses on the radial nerve for hours. The term is slightly tongue-in-cheek and refers to a motor weakness caused by drinking too much and falling asleep in a slumped position. However, any sleeping position that you sleep in too long places too much pressure on the radial nerve can cause the same type of hand weakness. Symptoms of Saturday night palsy include hand weakness, numbness, prickling sensations similar to when a limb has fallen asleep. Oh no. Diagnosis and treatment. Saturday night palsy can be diagnosed by symptoms alone and often does not require treatment once the pressure is removed. With that said, there are cases when prolonged compression causes severe nerve damage and the loss of hand function and sensation. Okay, so they're trying to say that there's certain non-steroid anti-inflammatory drugs or oral corticosteroids and steroid injections that may be used to reduce the inflammation and improve your symptoms. In rare instances, surgical nerve repair may be needed. Okay, so there's a new one on the list I have never heard of. Ulnar neuropathy is caused by the injury of a nerve called the ulnar nerve. This nerve, which controls the arm and the hand movement, is most often compressed at the elbow. Oh no. Mild compression of the ulnar nerve is caused by leaning on the arm, which produces a tingling sensation, often referred to as bumping the funny bone. Oh no. Okay, so symptoms is damage to the ulnar nerve from traumatic injury. Arthritis, compression, or infection can cause pain, tingling, hand or arm weakness. Loss of sensation, particularly with the ring finger. Diagnosis and treatment. The diagnosis and treatment of ulnar neuropathy are similar to other forms of neuropathy. If an infection is involved, typically bacteria, antibiotics may be prescribed. Traumatic injuries may require an elbow brace until the symptoms improve. Some cases require no treatment. Okay, so Cubital tunnel syndrome. I haven't heard of this one. Syndrome is a type of ulnaropathy. It occurs when the ulnar nerve located on the inside of the elbow is injured. Symptoms are caused by inflammation, swelling, and irritation of this nerve. So cubital tunnel syndrome is more likely to occur in people who use their elbows often for pulling, reaching, or lifting activities. It can also occur because of a previous injury to the elbow or because of arthritis. Symptoms of cubital tunnel syndrome vary from person to person and may include a weak grip, pain in the hand, aching pain inside of the elbow, numbness and tingling in the hand, especially the ring and little finger. This tends to occur most often when bending the elbow. Diagnosis and treatment. Cubital tunnel syndrome can be diagnosed with a nerve conduction test or These tests check how well your nerves are functioning. An x-ray can also help your healthcare provider determine if there is arthritis or bone spurs in your elbow. Treatment for this condition usually starts with discontinuing the activity that led to your symptoms. Some other treatments may include wearing a splint or brace at night, using elbow pad where appropriate, using one in the appropriate area, exercises to help improve nerve function and reduce pain, taking non-steroidal anti-inflammatory medications such as Advil, ibuprofen, and many others. Okay, so if the condition is resistant to treatment, steroid injection or surgery may be necessary. Okay. Multiple sclerosis, I've heard of this, is a chronic condition of the central nervous system. People with MS have damage to the myelin, which is the protective sheath that forms around the nerves. The cause of MS is unclear. MS is multiple sclerosis. Is unclear, but many experts believe it is an autoimmune condition where your immune system mistakenly attacks a part of your own body. MS can be mild or severe. Some people have periods where their symptoms get worse, followed by periods where their disease goes into remission. MS is a chronic condition, which means it can be treated but not cured. Most cases of MS get worse over time. Multiple sclerosis can make your hands weak, and your hands may also become easily fatigued, I guess just from doing everyday activities. Other symptoms of MS that may affect the hands include loss of sensation in the hands, numbness and tingling in the hands or feet. If you have multiple sclerosis, you may usually have symptoms elsewhere in the body, which can include stiffness and involuntary muscle spasms, fatigue, weakness, vision problems, coordination and imbalance issues. Diagnosis and treatment. There are no tests to diagnose multiple sclerosis. Your healthcare provider will usually base a diagnosis on your symptoms after ruling out other conditions that may cause similar symptoms. Multiple sclerosis is usually diagnosed if you have had at least 2 attacks that occurred 1 month apart or longer. If you have more than one area of damage, myelin that occurred at different times was not caused by another identified disease. The condition can't be cured but can be managed with medications, rehabilitation, and equipment to help you walk, such as braces and canes. Okay, so this next one is called lateral epicondylis, also called tennis elbow, which occurs when there is trauma to the elbow, usually because of stress caused by certain repetitive activities. The condition affects the tendons that you use to bend your wrist backwards. People who can play tennis often get tennis elbow, but it can also happen in people who use other tools like paint rollers or chainsaws, or engage in the same repetitive hand movement at work. Symptoms of tennis elbow may start with pain and burning along your forearm and elbow. The condition can cause symptoms in your hands such as weakened grip, pain when lifting or gripping objects. The diagnosis and treatment. Your healthcare provider can usually diagnose tennis elbow based on your symptoms. In some cases, they may also order imaging tests such as X-ray, MRI, or electromyograph. Okay, so treatment usually begins with discontinuing the activity that caused the condition. Other things that can help include bracing, ultrasound therapy, steroid injections, taking non-steroidal and anti-inflammatory medications like Aleve or Advil, exercises that help strengthen the muscles, applying ice to reduce inflammation. Surgery may be used in some cases, although it's not an uncommon way to treat this condition. Okay, so next on our list is a stroke. Hand weakness can be a symptom of a stroke, and it usually occurs along with other symptoms. A stroke is an emergency. If you think you or someone else is having a stroke, Immediately seek medical attention. Strokes happen when there is a blockage or hemorrhaging that prevents blood from reaching the brain. This is all scary. Okay, so symptoms of a stroke can vary and usually begin suddenly. May include weakness or numbness that affects only one side of the body, confusion and difficulty speaking or understanding others, difficulty moving or walking, vision problems, severe headache, dizziness, trouble with balance or coordination, confusion and difficulty speaking or understanding others. Diagnosis and treatment with imaging tests such as CT scan or MRI. These tests look for bleeding in the brain and check how well blood is flowing. Treatment should begin right away and may include medications that help break up blood clot and drugs to control swelling in the brain. And in some cases, surgery is needed to remove a blood clot or stop bleeding. Okay, so when should you seek a healthcare provider? If you have numbness or weakness in your hands that gradually worsens, comes and goes and persists over time, then don't forget to schedule an appointment with your healthcare provider. You should also see one if your numbness or weakness appears to be spreading or is related to certain activities. Seek emergency medical care if the numbness or weakness suddenly occurs after surgery or if there's symptoms of a stroke, such as weakness on one side of the body or confusion or difficulty moving or talking. Is a good time to see your healthcare provider. So there's many possible causes of sudden or persistent weak hands. Most are treatable and rarely serious, although they can cause significant discomfort and disability if it's left untreated. Some of the more common causes include carpal tunnel syndrome, diabetic neuropathy. Okay, so hand osteoporosis. They're really confusing me. Herniated disc, cervical radiculopathy. Okay, Saturday night palsy, ulnar neuropathy. Some of these can be treated with steroids or other anti-inflammatory drugs, particularly those associated with nerve inflammation or injury. Others may require physical therapy or surgery. It may also be necessary to treat these underlying causes such as diabetes or an infection before the hand weakness and pain fully resolve. Okay, well, that was a lot to take in, right, you guys? So also, don't forget to like the video. Don't forget to subscribe. Don't forget to watch my death series. Don't forget to watch my prison series. Don't forget to watch me talking about Diddy. And if you guys like me talking about health, please let me know. Let me know so we can continue this, okay? And I will see you guys on the next one.